Hello, my name is Jeff Weir, and I'm the CEO for the Saban Community Clinic in Los Angeles. I am honored and pleased to be here today to introduce our next Hero Award recipient, Congressman Henry Waxman. Representative Waxman represents California's 33rd Congressional District, where my clinic, as well as Westside Women's Health Center and the Adventist Family Clinic, is also located. And Congressman Waxman has been a supporter of our patients' needs and of the health centers for a very long time. A leader on health issues, Representative Waxman has fought for universal health insurance, comprehensive Medicare and Medicaid coverage, tobacco regulation, AIDS research and treatment, and many other things. Throughout the 1980s, Representative Waxman championed national health care reform and improvements in the Medicare-Medicaid programs. He successfully led the fight for prenatal and infant care for low-income families, for protection against impoverishment for spouses of persons in nursing homes, and for more services in the community for people needing long-term care. Prior to his election to Congress, Representative Waxman served 3 terms in the California State Assembly, where he was chairman of the Health Committee, the Committee on Elections and Reapportionment, and the Select Committee on Medical Malpractice. He's authored major legislation, including the Fair Campaign Practice Act, the Fair Credit for Women Law, and the legislation established standards for health maintenance organizations in California. No member of Congress has been more tenacious or more effective advocating for expansion to healthcare services. For all Congressman Waxman has done to help move America towards a more equitable healthcare system for all, the California Primary Care Association is proud to recognize him as a CPCA hero. I myself cannot think of a more deserving legislator for the award, and we will miss his presence in Washington very much. Unfortunately, the congressman is not able to be here with us today, but he has sent along a short video. So if we can take a look at that, please.
Thank you. I appreciate this recognition, especially coming from the California Primary Care Association. An award from you is really meaningful. We've been such good partners over the years, and you've done such good work for people in need. All the time I was in Washington, I knew that you, your staff, and your volunteers were working on the same issues that I cared about all along. Health care for everyone, regardless of who they are and regardless of how much they can pay. Whenever I worked on reproductive health, prenatal care, child health, and primary care for everyone, I always knew that if we could get something at the federal level, you'd get it to the people in California who needed it. And I knew that if we could expand Medicaid for all those people, you'd actually make sure that the services reach them. The political fight hasn't always been easy, to say the least. Many of you will remember the proposals for block grants and caps and cuts, both at the state and the federal levels. Reagan, Bush, Gingrich, and now Boehner and Ryan. We've had powerful opponents, but we won all those fights. And I'm happy to say that you can both deliver those services and actually get reimbursed for them so that you can get more care to more people. Since federal law requires that health centers be covered by Medicaid, you know that you will get paid. And since federal law requires that Medicaid pay at a rate that reflects your cost, you can count on Medicaid to be a better source of payment. This is not to say that the work is all done. Obviously, the Medicaid expansion and the ACA are still works in progress. There's a federal funding cliff that's coming for community health centers too. There are growing pains and there are big fights on the horizon. But someday we will really have universal coverage. Someday undocumented people will have access to primary care, and someday the health systems will work for low-income people as well as they work for people in private insurance and Medicare. But until then, centers will continue to be our best safety net. So we made a lot of progress. I've enjoyed and valued being a part of a team with you to make that happen in law and in real life. And while there's still work to do, I know I can rely on you to keep up those efforts. You're celebrating your first 20 years, and I expect even more from you in the future. It's been a rewarding pleasure being a partner with the Primary Care Association and all of your clinics. I'm retiring from Congress now, but I'm not retiring from these issues. You can still rely on me, and I look forward to continuing our partnership. Thank you very much.